Dear Ma'am Lali, ako po si Yan, isang office worker na nakabase at naninirahan sa Canada. Isang umaga, habang ako'y nag-aalmusal, ay napansin ko na nagkaroon ako ng severe flushing sa aking muka hanggang sa aking dibdib. Akala ko nung una ay dahil lang sa init ng panahon. Makalipas ang ilang araw, nagtuloy-tuloy pa rin ang flushing at sinabayan ito ng constant diarrhea, rapid heartbeat, at difficulty in breathing. At dun ko napagtanto na kailangan ko nang magpakonsulta sa espesyalista. Sa tulong ng aking tatay, ay nagpatingin ako sa telemed.
Hi, good evening. I'm Dr. Quijano. May I ask what have you been feeling for the past few days?
Good evening, Doc. I was just having a breakfast when I noticed a flushing on my face and upper chest. At first, I ignored it since it may have been caused by the hot weather outside. However, after a few days, the flushing was followed by diarrhea, rapid heartbeat, and sometimes difficulty in breathing.
Okay, so for now, you'll undergo first for some lab tests to see if I could find something.
Yes, Doc.
Hi, so your lab result came, and based on the results, it shows that you have a rare disease, and the symptoms that you're experiencing falls under the carcinoid syndrome. This was triggered by the flooding of net in your systems with substances like the hormone serotonin. So those chemicals that leak cause skin flushing, lesions, shortness of breath, and bowel changes. Now, I would advise you to undergo treatments that will help in your diagnosis. Also, I will transfer you to the experts that specialize in this kind of disease. Isn't this okay?
Would it be alright to discuss this with my father? I'm still quite lost about all this.
Sure.
Okay, answer the phone. Hello, Doc Juliet.
Hello, ma'am. Do you mind?
I'm quite busy. What is it?
Ma'am, I have this rare disease that requires your attention.
That being,
Well, my patient has carcinoid syndrome, but it seems to have a rare complication along with it, similar but different from cancer. I myself can't handle the case since I'm not specialized in this complication. Thus, I need your approval to gather some specialists to help tackle this case.
it really sounds complicated. So, kindly wait for me and later we'll gather all the stuff. And let's look for a seminar and a research regarding that disease, okay?
Okay, ma'am. Thank you.
Dad, what do you think of this?
Honestly, dear, I'm not quite sure it's safe. Your mother was already taken by something similar. I can't wholeheartedly condone something that could take you away from me, too.
I understand that. I know how hard it is. Hello, Doc?
Hi.
I'm sorry, Doc, but I have to decline. You see, I'm just an ordinary office worker. I don't have the huge amount of money to participate in the clinical trial.
Okay, ma'am, I understand. If I have news about your disease and how to treat it, I will be contacting you.
Good evening, everyone. So, today we'll talk about carcinoid syndrome. It occurs when a rare cancerous tumor called carcinoid tumor secretes certain chemicals into your bloodstream, causing a variety of signs and symptoms. So, what are these signs and symptoms? Here are the most common signs and symptoms. It includes skin flushing, the skin on your face and upper chest feels hot and changes color, facial skin lesions, diarrhea. Next is difficulty of breathing. Lastly, fast heart rate. As for treatments, can it be treated? Yes, but it involves treating the underlying cancer and using medication to alleviate certain signs and symptoms.
Hi. So I already talked to the head of the department, and she agreed that 40% of your fees will be secured by the hospital. And we also found sponsors and charities that would want to handle the remaining 60%. So are you willing to undergo the clinical trial?
If that would be the case, I would give my consent and participate on the clinical trial.
Okay, so I will just schedule you for your treatment. Thank you.
Thank you, Doc.
Dear, I heard what the doctor said. They told me what you want to do. Are you sure about this?
That I can't keep sitting by and letting something like this take over my life. I know mom's gone and I miss her every day, but you can't just let me slowly die like this.
If this is what you truly want, then I'll support it.